Communication accessibility is where we start to think about a wide range of options with communication as the goal. So as in, I want to get an idea across to you and I need you to understand it and then respond back to me. That doesn't necessarily have to look like talking. A lot of people assume that communication is talking. A lot of people, a lot of kids, a lot of people with disabilities, they find talking really hard. It's really complex. If you think about it, there's a lot of things going on. You have to have an idea, you need to move that to your language center in your brain, find all the different words in lots of different areas, put them together to string a sentence together, move that to your motor area to work out how to physically say it and then be able to spit it out. That's a huge question. Basically, speech pathologists can help people learn how to say their sounds better if people are finding them hard to understand. They can help people improve their language, to string a sentence together really well, use their grammar properly, and also to find alternative forms of communication if they're having trouble talking, so using pictures, iPads, sign language, that kind of thing. First thing you want to do is find out how they communicate. So you speak to the people in their life who are close to them, speak to the person directly, find out what their communication mode is. Do they speak well? Are they using sign language? Are they using pictures? So that's your first one. Find out how they communicate best. Find out how you then can get access to that sort of communication method and be respectful of it. That's probably the big ones. Find out what they communicate, how you can access that communication, and be respectful. They can help with communication. They can help adults with disabilities find their most effective form of communication. They also can help adults who have had strokes or brain injuries or have acquired sort of disorders that are degenerating, and they can help them maintain what communication they have or improve it in whatever ways they can. And also they work with feeding difficulties as well. Speech therapists can do a huge range of things to help children as well. So again, they can help children fix up their speech sounds if they're hard to understand. They can help them to string sentences together, to use different bits and pieces of grammar and to understand what they're being told. They can find the most effective communication method for them. They can help with social skills, literacies, learning how to read and learning how to understand what they're reading, learning how to spell. Yeah, a whole lot of different things. Speech clarity can mean a whole lot of different things. Probably the biggest one that most people think of is my sounds are a bit strange. So if I say things like wed instead of red, it can be hard to understand what I'm saying. Sometimes kids can say words really well, or anyone of any age can say a single word really well, but when they put their sentences together, it gets a bit mushy. So really it's about trying to fix up particular sounds if there's a difficulty there, or even working on saying things clearly and slowly and really thinking about what you're saying to make sure that other people are understanding.